So, slide 54, the flexors of the knee joint. Here's our major list. The flexors of the knee joint are located in the posterior compartment. And here's a picture showing us the posterior compartment on the bottom of the picture. And there are the hamstring muscles back there, shown in purple burgundy color. So the flexors of the knee joint are the hamstrings, which from lateral to medial are the bicep femoris short head, which is deep, the bicep femoris long head, which is a bit superficial to the short head, the semitendinosus, which is superficial to the semimembranosus, which is deep to it. Then there is the popliteus, a little strap across the back of the knee, and the sartorius, a really interesting muscle. So that was posterior view of the different muscles with a superficial view and then a deep view. And this is a medial and lateral view of the hamstrings. So the three hamstrings originate on the ischial tuberosity. The bicep femoris has a short head that originates on the femur. The three hamstrings insert on the tibia. The bicep femoris also inserts on the fibula a bit. The three hamstrings extend the hip joint and flex the knee joint. Because they cross the hip joint and they cross the knee joint, they are able to act on it. They each also rotate the knee either medially or laterally, and we'll talk about each of them individually. So the bicep femoris, the most lateral hamstring muscle, these are the origins: the long head, the ischial tuberosity; the short head, the femur, the linea aspera. The insertion is the tibia laterally and the fibula. You can look over at the picture on the right. Then their action at the hip joint is extension and lateral rotation, and at the knee joint is flexion. And I think that looking at how the bicep femoris slants from the ischial tuberosity to the lateral tibia and fibula, you can imagine how when it contracts, it causes a bit of lateral rotation in addition to the other actions it has. The semitendinosus originates on the ischial tuberosity. It inserts on the tibia medially. The action at the hip joint is extension and medial rotation, and on the knee joint is flexion. The semitendinosus lies between the bicep femoris and the semimembranosus. And I think that if you look at the origin on the ischial tuberosity and the insertion on the medial tibia, you can imagine that when it contracts, it causes medial rotation in addition to its other actions. The semimembranosus has an origin on the ischium, the ischial tuberosity, and it inserts on the medial tibia. The action on the hip joint is extension and medial rotation. The action on the knee joint is flexion. The semimembranosus is the most medial muscle, and the two M's or three M's that are in semimembranosus remind me of medial. And then I remember that this is the most medial muscle, 3Ms. And again, if you look at the origin and the insertion, you can imagine that this muscle causes medial rotation of the femur in addition to the other actions it has. The popliteus and sartorius are two unique muscles that flex the knee joint. So first, the popliteus, it originates on the femur laterally and inserts on the tibia posteriorly. The action is flexion of the knee and medial rotation of the tibia. And this, in my mind, is sort of analogous to the anconeus muscle in the elbow, a little short strap spanning a joint. Okay, now the sartorius is a really interesting muscle. The origin is on the ilium, the anterior superior iliac spine, and the insertion is on the tibia medially. So it's like a sash that beauty queens wear, like in beauty pageants. It's like a sash across the femur. The action at the hip joint is flexion and abduction and lateral rotation all at the same time. And at the knee joint, flexion. So one by one, you can take those actions and build together a picture of the action of the sartorius. And the picture on the right, I think, does a pretty good job of showing that at the hip joint, we've had flexion, abduction, and lateral rotation. And at the knee joint, we've had flexion. The word sartorius means tailor. The muscle was so named because tailors once sat cross-legged. Okay, there's a table. Okay, so now moving on to extensors of the knee joint. There's our group circled on our master list. So the extensors of the knee joint are located in the anterior compartment. And we see here the anterior compartment. It's green. It has the extensors of the knee joint in it. And you can appreciate that although the muscles can be thought of as anterior, and certainly the rectus femoris is anterior, these muscles do wrap around the femur. So although they are anterior muscles, they are really large and wrap all the way around the femur. So the quadricep group includes the rectus femoris, the vastus intermedius, and the vastus lateralis, and the vastus medialis. Here's a picture that is first is the anterior view, and then the next picture just has a medial view and a lateral view for you to appreciate. So a little overview, the rectus femoris is anterior and center in the thigh. The vastus intermedius is deep to it. The rectus femoris is surrounded by the three vastus muscles like a hot dog in a bun, they say. And it's kind of accurate. The femur, deep to the vastus intermedius, is also surrounded by the three vastus muscles. And you can get a picture of that by looking at the cross section to the right, showing the anterior compartment, and then showing the different muscles in the quadricep group wrapping around the femur. Okay, so now let's take the muscles individually. The rectus femoris originates on the ilium, the anterior inferior iliac spine, the area superior to the acetabulum. The insertion is the tibial tuberosity, and the actions are flexion at the hip joint and extension at the knee. The vastus intermedius is deep to the rectus femoris. The origin is the femur, and the linea aspera, which is a posterior ridge on the posterior of the femur. And the insertion is the tibial tuberosity. The action is extension of the knee joint, and the muscle wraps around the lateral femur. So in the second picture in this slide, you can see that there's a really big, the origin here on the lateral femur. So even though it's kind of hiding, it's still a really important muscle. And we can look at our cross section and see how the vastus intermedius wraps around the femur. Then there is the vastus lateralis. The origin is the femur, the anterolateral part, and the linea aspera in the posterior femur again. The insertion is the tibial tuberosity, and its action is extension of the knee joint. It wraps around the lateral femur and is seen, when looked at laterally, it's seen both anterior and posterior to the iliotibial tract. The vastus medialis originates on the femur, on the anteromedial side, and also on the linea aspera. The insertion is on the tibial tuberosity. The action is extension of the knee joint. This muscle wraps around the medial femur. And if you look at the third picture and you look at the origin point, you will see there is a large medial to posterior origin. Okay, and there's our table. All right, so now we move on to the ankle joint with plantar flexors of the ankle joint. Here we see our list. And the plantar flexors of the ankle joint are in the superior and deep, posterior, and lateral compartment. So everything but the anterior compartment. Dorsiflexors or extensors of the ankle joint are in the anterior compartment. Okay, so the plantar flexors are the gastrocnemius, the soleus, the plantaris, the tibialis posterior, and the fibularis longus and fibularis brevis. This is a posterior view. The plantar flexors of the ankle joint are posterior. Plantar flexion of the ankle is in a posterior direction in the sagittal plane. We plant our foot on the gas pedal. We plant our feet on plants. That's how you can remember plantar flexion. The gastrocnemius is the most superficial muscle. The soleus and plantaris are in the intermediate layer, and the tibialis posterior is the deepest. So you can look at those three pictures to get a feel for that. The gastrocnemius originates on the femur and so can act on the knee joint. The origin is on the medial and lateral condyles, and the insertion is on the calcaneus through the Achilles tendon. The actions at the knee joint is flexion, and at the ankle joint is plantar flexion. Often when they talk about the gastrocnemius, they'll talk about the medial and lateral head. That just means the part of the muscle that originates either on the medial condyle or on the lateral condyle. The soleus is a synergist to the gastrocnemius for plantar flexion. It is a postural muscle for standing. It resists the tendency to lean forward over the foot. There is more weight in the anterior half of our body than in the posterior half. So, there's a struggle. Our erector spinae muscles in our back are working all the time to hold us up. And the soleus is a synergist that is also working overtime to hold us up. The origin is the tibia and the fibula. You can look at the picture on the far right to appreciate that. The insertion is on the calcaneus via the Achilles tendon. The action is plantar flexion of the ankle joint. Notice that this muscle does not cross the knee joint, so it cannot act on it. It can only act on the ankle joint. Okay. The plantaris. The plantaris is a thin little muscle. It can be cut without an apparent loss of function, so it's thought to have a modest contribution to any action that it performs. So the origin is on the lateral femur. The insertion is on the calcaneus. At the knee joint, the action is flexion, and at the ankle joint, the action is plantar flexion, but all sort of weakly. Okay, the tibialis posterior. The origin is on the tibia, the fibula, and the interosseous membrane. And I think the best picture to see that in is the picture that's between the little foot and far right picture, the middle picture, okay? You can see there the origin. The insertion is on the tarsals of the ankle joint and also metatarsals 2, 3, and 4. The action is plantar flexion of the ankle joint and inversion of the foot. The tendon is posterior to the medial malleolus. The fibularis longus and brevis. The fibularis longus is superficial to the brevis. The origin is on the fibula. The insertion of the longus is a tarsal bone down in the group of tarsal bones and metatarsal 1. The insertion of the brevis is metatarsal 5, 1 and 5. The action is plantar flexion and eversion of the ankle joint. It helps to support the arch of the foot. The tendons are posterior to the lateral malleolus, which you can appreciate in the picture to the far right. Okay, a couple of slides on the dorsiflexors of the ankle. So the tibialis anterior is just lateral to the sharp anterior border of the tibia. Its origin is on the lateral tibia. Its insertion is on a tarsal bone and metatarsal 1 on its inferior surface. The action is dorsiflexion of the ankle joint and inversion of the ankle joint. The tendon of this muscle is anterior to the medial malleolus, so not tucked behind the malleolus now. And we have the origin in the picture that's on the far right. And notice that we said that the origin was on the lateral tibia. It is, and it's attached along quite a large stretch. So that was an anterior view. And the next slide is of a medial and lateral view. And then we have our table. And then we have flexors and extensors of the toes. And we've come to the last group. The flexors of the toes are in the deep posterior compartment specifically. That compartment is almost in the middle of the bone if you think of the bone as being just a big round thing. Okay. The extensors of the toes are in the anterior compartment. The flexor digitorum longus is medial to the tibialis posterior. The origin is on the posterior tibia. The insertion is on the phalanges 2, 3, 4, and 5, the inferior surfaces. The action at the ankle joint is plantar flexion, and the action on the toes is also flexion. The tendon of this muscle travels to the sole of the foot behind the medial malleolus. The extensor digitorum is deep and lateral to the tibialis anterior. The origin is the lateral tibia and the anterior fibula. The insertion is on the phalanges 2, 3, 4, and 5, their superior surface. The action at the ankle joint is dorsiflexion, and at the toes is extension of 2, 3, 4, and 5. There is a table, and then This is the last slide. It's a clinical correlation, just to let you know that there is such a thing as shin splints. Repetitive use of the leg muscles, for example, with long distance running, can stress the tibia or the shin and cause pain or shin splints. The attachments of the muscles to the tibia are pulled during muscle contractions. Continued overuse injures the tibia and can lead to stress fractures. The tibialis anterior and the extensor digitorum longus may be involved in anterior shin splints. The flexor digitorum longus may be involved in posterior shin splints. And you see in the picture below, anterior and posterior shin splints, along with the muscles that are being overused and are causing the bone to be injured. Remember, this goes back to us saying that collagen fibers are very strong and they can be stronger than bone. So there's a crisis where it needs to be decided which part will be injured. It will be the bone that is injured and not the collagen fibers that are interweaving with the periosteum and the tendon and the layers of collagen within the bone. And they're all melding together. And if there is pulling on the bone, there will be injury to the bone rather than to the tendons. So interesting, right? Okay, I will say goodbye.